everyone, this is Dr. Shweta Jain from iMantra Hospital. As you all know that we at iMantra Hospital strive to make people aware of the eye conditions that they may face at some point of their life or other. We are going to cover another eye condition in this video that you must know. Xanthelasma is one condition which is not seen in the eyes though, but is present around the eyes and make your face look non-appealing. So, in this video, we are going to cover the following things. What is xanthelasma and how is it different from xanthoma? Who is more prone to get this eye condition? What are the causes of it? What are the risk factors associated with this condition? How do we diagnose this eye problem? How do doctors treat xanthelasma and how can a person prevent this condition? So, let's get into this video. First of all, let us understand what is xanthelasma. Xanthelasma is a disease that involves soft, yellowish growth on the eyelids and around the eyes. These growths are composed of fat deposits that accumulate beneath the skin and produce a raised, bumpy region. While xanthelasma are not harmful, severe by themselves, their existence may signify a more serious underlying illness. It is quite different from xanthoma. Let us see how. The term xanthoma refers to a buildup of cholesterol or fat under the skin. Xanthoma might be as little as the tip of a pen or as large as a grape. They might occur as a single growth or as a cluster of growth that forms a rough textured look. Xanthomas can occur anywhere on the body. However, the most prevalent sites are hands, feet, heels, buttock, behind the knees and elbows. A frequent variant of xanthoma that develop around the inner area of the eyelids towards the nose is xanthelasma. Xanthelasma are often modest and while elevated do not swell as prominently as xanthoma. This takes me further to the next topic of this video, that is who's more prone to get this eye condition. The disorder is uncommon but it can occur if you have excessive amount of cholesterol or other lipids in your blood. It can also happen if the cholesterol levels are normal. The majority of those who acquire it are in their 40s or 50s. It affects more women than males. If you have it, you should get your blood test done to check your cholesterol level. If you have understood all that has been conveyed till now, I would like to take you to the next part, that is the causes of xanthelasma. Many patients who have xanthelasmas have a lipid issue. Lipids or cholesterols are fat that flows in the circulation. Low density lipids, which are bad cholesterol, and high density lipids, which are good cholesterol, are the two varieties. The bulk of your cholesterol is composed of low density lipids, that is LDL. High LDL levels can increase your chances of developing xanthelasmas, strokes and heart disease. High density lipids, HDL, absorb LDL and transport it to the liver where it is flushed from the body. High HDL level reduce the risk of stroke, heart disease and xanthelasma. Xanthelasma development is usually caused by high LDL levels or low HDL levels. Lipid abnormalities can occur as a result of metabolic illness, influences how fats are metabolized in the body. Genetic disorder leads the body to create excessive LDL or insufficient HDL, excessive consumption of saturated fat and inactivity. These are all the causes of xanthelasma. Now, when the eye problem affects a person, it can lead to various other risk factors too. While xanthelasma can affect anybody, your chances of having it are higher if you have unusually high quantities of lipid, you are overweight, have diabetes, suffer from high blood pressure, smoke, are between the ages of 30 and 50 and have Asian or Mediterranean ancestors. It's worth noting that you might have one or more of these characteristics and never develop xanthelasma. The possession of these features, on the other hand, puts you on a higher danger. Now, how do doctors diagnose the presence of this eye problem in a person? Because the signs of xanthelasma are visible, it is rather easy to diagnose the disorder. In reality, xanthelasma is usually identified because the patient observes it and reports it to the doctor. To get a formal diagnosis, your doctor will check the skin around the eyes. They may also collect blood and do tests to determine your lipid levels. Once you are diagnosed with the problem, the treatment becomes mandatory. The medical science are now developed enough to provide treatment for almost all diseases. There are many treatment methods possible to recover from xanthelasma, some of which are: treatment for xanthelasma is usually sought for aesthetic reasons, as the fat pockets are not hazardous and seldom interfere with vision. However, if the xanthelasma expands and begins to weigh on the eyelid, ptosis may develop. Because xanthelasma removal is often a cosmetic operation, insurance is unlikely to reimburse any amount. The following procedures can be used to eliminate xanthelasma. First, medicine. Studies have indicated that simvastatin, a prescription medication, successfully decreases cholesterol level, which may help with xanthelasma. Chemical peels, a non-invasive therapy that removes the top layer of the skin, exposing fresh skin cells underneath. Third, laser surgery, a type of laser resurfacing known as fractional CO2 that eliminates the layer of tissue. Fourth, chemical cauterization is a topical therapy that uses chlorinated acetic acid to produce protein and break down lipids, thereby removing the xanthelasma. Electrodissection is the use of electric needle to scrape or burn out the xanthelasma. Cryotherapy, a procedure in which xanthelasma is removed by freezing it with liquid nitrogen or ice. All these techniques are most effective when done at an early stage or when xanthelasma is relatively small in size. Lastly, conventional surgery entails the surgeon of removing the xanthelasma with a knife or scalpel. This is a patient on which we had done xanthelasma surgery right eye followed by left eye. While all these techniques are effective at removing xanthelasma, it is crucial to remember that each of them can result in some amount of scarring. Furthermore, xanthelasma may return or develop elsewhere once these operations are completed. It is critical to contact a surgeon who is skilled in executing these treatments for the best outcomes. Last but not the least comes the prevention of xanthelasma. There are several preventive measures that you can practice to avoid having this disorder. Some of them are: individuals who are genetically prone to high cholesterol may find it difficult to avoid xanthelasma. These are, however, actions you may do to decrease your cholesterol and your chances of having xanthelasma, such as smoking cessation or avoidance, limiting your alcohol consumption, limiting your intake of saturated fat, which include milk, butter, baked product, and processed meat like sausage and bacon, consuming healthy cholesterol-containing foods such as whole grain, beans, lentils, olive oil, and fatty fish, keeping a healthy weight, exercising for at least 30 minutes each day with moderate to intense activity is recommended. This is everything that you need to know about xanthelasma, its causes, diagnosis, treatment, prevention, and everything else that keeps relevance. I hope you have extracted some valuable knowledge from this video. If you have ever experienced the same, you can let us know in the comment section. If you like this video, then hit the like button and subscribe to our channel for more informative notes about the eyes. Also share this informative video with your friends and family. Thank you.